All right, what's going on, PT entrepreneurs? Dr. Matta here with the PT Entrepreneur Podcast and in the Facebook group, the PT Entrepreneurs Facebook group. Once again, today you got me by myself. I am solo. My wingman, Eve Gigi, isn't feeling so great, got a little stomach bug, and can't make this one. So I get a chance to go over a topic that I think is incredibly important, especially as you start to really grow your company past yourself. And that's how you retain really high quality people. If you haven't, really been paying attention to the profession, and maybe you're just in it every day and you're grinding, there is a ton of turnover within our profession as a whole, not necessarily just within, small businesses like we help, but in the profession in general. I was having a conversation with a PT that does a lot of clinical education work just the other day, and he told me that there's estimated 15 to 20,000 physical therapists that just left the profession in the last year. Now, that's people that are just leaving the profession. They're probably burnt out. They're doing something else. So we're dealing with fewer clinicians that are in the profession, and we have to find the right ones for our business that fit the model that we have, that align with our values, and really, more than anything, be able to build an opportunity for them to have an amazing job. I mean, that's the way I look at it, right? I was always told that, if I couldn't find the job of my dreams, that I should go and build it, right? Go make that job that I couldn't find anywhere else. And to be honest, when I left the military, if I could have found a really cool job at a cash practice, like treating patients the way I wanted to, I don't think I would have ever started a practice. None of those existed in the way that I wanted to practice. In fact, I only knew of one other cash practice in the entire city of Atlanta at the time, and it wasn't like one that was employing anybody that I would have even gone to work for. So I didn't really have much of a choice. But nowadays, people do have those choices, and they can find great employers, great practices where they can work with people that are very specific populations, and you get a chance to employ them. And that's actually like really one of the key benefits that I've seen happen over the last probably 5 years, is that these practices, these cash and hybrid practices, are far more scalable, and they create opportunities to allow clinicians to really work in an environment that is better for the longevity of both their time with an employer, but also for their career, because a lot of people are leaving the career. So I'm going to get into some retention techniques, things to think about, and best practices. And a good chunk of this is based off of our own practice, our combined information and practice of right now. Just within our mastermind, we have about 225, 230 businesses that we're working with that are actively trying to grow. Most of those are cash and hybrid practices, and hiring a ton. Tons of hires, always looking to hire. If anything, it's more of a problem of finding talent sometimes, because there's so many people that are growing and trying to hire on other people. But this also, in some ways, is somewhat of a unique advantage that I have, where I get to sort of take a glimpse into a far bigger company. So one of my family members, she works for a huge consulting company, and her job is, she's a director of talent retention, is what they call it. So basically, how do we keep people in our consultancy for as long as humanly possible? And some of the ways in which that they're doing that and maintaining long durations of periods of employment with people is very interesting, and things that we can apply to these smaller businesses as well. So I'm going to share some of that as well. So let's start with some of these variables that really lead to whether people stay or leave. And the first one that is probably going to make or break your business in general is your culture. And there's a phrase, I don't know who said it. I'm not even going to try to, it's not me, so don't quote me, but somebody else said this first, and they said, culture eats core values for breakfast, right? Like, a lot of people will say, these are my core values, and they put them up on on the wall, and they reference them. And that's cool. Like, I think it's important to understand what your core values are, and to, embed them into your business somehow. But your culture is really, your culture is the core values in practice. It's like the living variation of your core values. And your culture is something that people can feel. It's something that employees understand, that potential clients coming in can feel. And it's like the energy of your company. It's how you guys work together. It's the way in which you work, the uniqueness of it. And culture is something that you get a chance to define when it's your own company. It's actually one of my favorite parts of owning a business, is defining what the culture is. You decide what the important things are and what are not important, right? You decide the decisions that you make on a day-to-day basis and how that aligns with your culture, right? You have a culture of like super hard charging and always working. You may have a culture that's very laid back. You may have a culture that's fun and you enjoy whatever activities that are outside of the business together. You may have a culture of excellence where everyone is striving to be the best they possibly can be. You may have a combination of all those things together. But we've all been in different environments where we've had work cultures that are really good and some that are really bad. It's very similar to teams. If anybody's played on a sports team, you have been on teams where there's just like everyone clicks and works together, and there's an understanding of what's expected and acceptable on those teams. And a lot of success can follow that. And then you can have teams where there's a lot of talent, but the culture is really bad and people are not working together and nothing really clicks. And there's a big difference in the outcomes of those. And the culture of your company is very similar. And you get to define that, right? So is it that you guys do, a meeting once a month at a brewery, or maybe you do a team workout together somewhere once a month and follow that up with, catching up on what you need to do on the business side. Maybe it's that on Fridays, everybody cuts out of there at noon. You don't want anybody there any longer than that, so they can enjoy a long weekend. Maybe it's that you have very specific maternity policies. Maybe you're, a female entrepreneur and you've had kids and you have a bad experience with a 6 months maternity leave or 6 week maternity leave policy. And all of a sudden you're back and, you're always like, felt like that wasn't enough. And now you get a chance to change your own maternity policy. And you make this a very welcoming place for someone that wants to have a family. You change the culture based on that, family first or work first or whatever it is that you're going to do. But the culture that you have is going to be a reason why somebody stays or leaves. So if you want to, again, attract this, let's say you have a women's health specific niche and you have a lot of female providers and you have this very, strict maternity policy and you expect people to be, right back to work in 6 weeks and, you don't have anything that really supports them. You're not very good about, giving them time off when need be, when their kids get sick. Like the culture doesn't coincide with the type of people that you're trying to appeal to and to maintain. So there's an incongruency there that's going to cause friction, and that's going to cause people to leave, right? If your culture is that you want to be the best providers in your area by a long shot, and yet you never do any sort of ongoing case presentation work, you don't really prioritize clinical education or research or any of the things that are going to lead to a better provider, well, you're going to lose people that are looking for that because that's the type of culture that they're looking for. So you got to define it and you got to stick to it. So your culture is huge and you get to define that, which is really like one of the more fun parts of owning a business. Pay consistency is a second variable. The amount of money that somebody makes is one thing, and that's fine. But the likelihood that somebody makes that amount of money is more important when it comes to retention. And what I've seen, and I've been guilty of this myself, is especially in the cash world, we are very quick to build out compensation plans that have very low base salaries and are heavily compensated via performance bonuses. And this is really something that's much more common in the sales world. So if you look at somebody that's doing like software sales or they're doing medical sales or whatever, they usually have like a very low base salary and they'll have a really, big compensation based off performance, which, can drive people to really want to sell. The challenge in our profession is most clinicians are looking for security, not for a medical sales job. And you can't pay somebody the way you can pay somebody that's doing software sales and medical sales either, because you're not making as much money as they're making. They're not selling a screw to somebody for some sort of joint replacement that's going to cost like $3,000 just for the screw. Like it's just not going to work that way, right? So the amount they can make is far lower. So security and likelihood of payment is actually really important. So being able to get a comp model down correctly that has, a high enough amount of guaranteed income, if not potentially all guaranteed, is going to be far more likely to keep somebody around than somebody that has a base salary that makes up 30%, 40% of what they can make in a month, and the rest comes off the back of the volume that they're seeing. And this is very much how we set up our compensation early in our career. And it was because it took risk off of me as a business owner and put it onto that employee. But what does that do to that employee? Well, now they realize, okay, I have a lot of skin in the game. I'm taking a lot of risk. Why would I not just go do this myself? Because this is not a safe place to work. I have ups and downs just as if I had started my own business. And it definitely did create turnover for us by doing so. And I've seen this again and again and again when people do that. And now if you really look at it, retention really comes down to, in a big part, the pay consistency, the likelihood of income occurring, not just how much they can make. Because if you get somebody that has a really low salary and they have a big compensation opportunity on the upside, you're basically hiring entrepreneurs, and eventually they're going to lead to become full-fledged entrepreneurs. So you're going to want to back into what works for your numbers, but as much consistency, as much guaranteed income as you can is going to be a really big key for them. All right, number 3, work-life balance. So we have been able to hire now in multiple companies, multiple people that came to work for us at a pay decrease from a more advanced, more, I guess, requirements in their job, more demanding job. They came to work for us, both within our, physical therapy practice as well as within PT biz, that they're incredibly talented people, and they were getting burnt down at these other jobs because they had terrible work-life balance, and they got paid well, but they had awful work-life balance. So if you can give somebody a really good work-life balance, like to the point where their job doesn't become their life, and now all of a sudden they can enjoy things that they really like outside of work, you create a better opportunity for that person to work for longer, to not get burned out, and find satisfaction in the place where they work. So I'll give you a couple examples. We've been able to bring someone, multiple people on the PT biz team, but one person in particular who was managing big construction projects, like $50 million buildings that were being put up as a construction project manager. This is a well-paid job. This person does a really good job of managing projects, of managing people, multitasking, being able to understand financials and being very detail oriented. All of these are very important skills, especially for what this role turned out to be within PT biz. And what we're able to do is have a conversation with this person and say, okay, like we like you, we like your skill set. We cannot afford to match your salary for what you're making with this huge construction company. And also what we're asking you to do is going to be far different in terms of work hours, work intensity, no travel, and to be able to offer a better work-life balance with still a good compensation package allowed us to get somebody on our team for significantly less than what their compensation was working for this other company. And for them to say, yes, I want to do this, it's not all about money. It's about, what else am I able to do? At a certain point, people are not willing to exchange more money for less satisfaction and not being able to see their kids and things that are very important to them. So keep that in mind. On the flip side, we've had the same thing happen in our local practice, where we've been able to hire senior clinicians that are clinic directors at other places, and they're working 50, 60 hours a week sometimes, documenting, every Saturday morning just to catch up. And all of a sudden we can say, hey, like, you can be an amazing clinician. You can just be great at that. You don't have to worry about all this additional stuff. Like, your documentation is going to take a fraction of the time because we don't have to try to justify it to Blue Cross and try to get more visits. And it's very much a direct patient to provider relationship. And it's a pure sense of that. So people that are looking to be amazing clinicians, they want to be world-class at being a great clinician. They thrive in that environment. They look for that environment. They don't want to do all the questionnaires that Medicare wants, you to fill out. They don't want to do all the work comp stuff. Like, they just want to get somebody better. And you strip away that stuff and you let them focus on that. And all of a sudden they go from working, 50, 60 hours a week to, let's call it 30, 40 hours a week. Now they've gotten, 15, 20 hours of their week back. They can go do other things and they're not as mentally stressed out. So what's that worth? Well, it's worth, a ton to them, and they'll take less potential, income from it. They're not generating as much income either. But to be able to have a better work-life balance is huge. So you can do this now. You can have people that can have more flexible work schedules, that can have more flexibility with time off, with when they're, coming in or not, if they want to be involved in pick up, drop off with their kids, if they want like flexibility with the things that are important to them. And it's not always family. For some people, they don't have families, but there's other things that they enjoy doing. And if you can match up your job that you're creating for them with the things that are important to them, and it still makes sense on the financial side for your business, it's an absolute win-win. It's a great way to not just retain talent, but to find talent and attract talent that wants to come and work in that environment. And that, again, really fits your culture. So the first three, and these are the three big ones: it's culture, it's pay consistency, and it's work-life balance. These are the three big ones that we see really help maintain a great employee relationship for a long period of time. The next two come directly from my family member that works for this big consulting company. And when I say big, I mean like one of the big four in the entire world. They're enormous. And her entire job is to really work on retaining people, keeping people in this consulting firm. And what I thought was interesting was there was two things that she said really do a good job of retaining people and keeping them motivated and happy. And the first one, I was kind of surprised by when she told me that it's the number one reason why people stay or go within this organization. So it may not be a complete one-to-one, it might be apples to orange comparison, but it's probably pretty close. And I've seen the same thing myself. And what she said was direct one-to-one mentorship is the number one reason why people stay or go with your superior, or whoever your direct report is. In this case, if you have a small company, you're the owner and there's like two clinicians, it's going to be you, right? Like you're the direct report. And in this big organization, maybe it's that this is like a, initial like consultant one, and then they're reporting to a manager or something, not all the way up the chain to like the people that own the consulting firm. So that one-to-one mentorship is literally the most impactful way that they decrease churn with their employees. And I thought that was just so interesting, because you would think it was like all these crazy benefits packages and what they're making and, career opportunities, all this stuff. And no, it came down to whether they felt like they were progressing individually and in their career, and that they were getting face time with the people that would help them really continue to grow along the career path they were on. Now think of this yourself, right? If you have clinicians that are coming in and you're not mentoring them one-to-one, what an easy win this is going to be for you to start doing this on a regular basis. This could literally be on, a monthly basis. You have a conversation, you sit down individually with each of your team, your two staff members, and you have lunch with them individually. This is maybe, structuring more quarterly mentorship sessions. This is asking them what they would like to learn more of. This is even like something as simple as a book club where you can say, hey, I think this would be a great book for you to read. I've read it. I'm going to read it along as well. Hey, at the end of the month, let's talk about what we learned, and applying that to somebody. People love mentorship. They love people helping them and being a part of their journey and of their development. And we get very little of that. Like this idea of apprenticeship is just not that common anymore, except if you're in the trades. If you're a plumber, if you're an electrician, apprenticeship is huge. It's one of the best ways to learn. And we get some of this in like clinical education when we're in school, but once you're outside of that, it doesn't mean that we're not still trying to grow. So if you can understand through the lens of apprenticeship that people want to do that, they want a mentor, they want someone to help them, figure out what to do next and to develop both personally and professionally, that right there might be one of the strongest ways that you can retain people. Now, this at scale gets hard, right? Because let's say you have 10 people that you're having to meet with every single month. This is where you really have a hard time making the decision of like, oh, can I see patients anymore? Like what things can I cut out? Or do we need to get a manager in place that can be that direct report to really help with that? And that scale, it's not as easy. But if you have a small business, this is one of the easiest things, one of the biggest wins you can do. And it's completely free besides your time. Like that's huge. The second thing that she told me, and this is what I'll finish with before I wrap it up, is people love a clear path. And when we have newer businesses, like, our businesses are not big. They're even if our business is, let's say, 10 years old, like our practices, that's still a decade. That's not that long if you think about it. Some of these businesses have been around for 100 years, and they've figured out a lot of things and what their path is and the path for their employees as well. So when she broke this down to me, I thought it was interesting because it's very similar to the military. This is the way that I thought about it, is when somebody comes in to work with them, they're a consultant, like level 1, and then it's like a consultant level 2, and then it's like a manager, and then it's like a manager level 2, and then it's a director, and then it's a director, advanced director, or something like that, and then it's a partner. And this partnership track is what is dangled in front of all these consultants to keep them around in a lot of ways. The same thing can be said for other types of big service businesses, professional businesses. I have a friend that's a partner in a engineering firm, and it's so similar. It's engineer 1, engineer 2, it's senior engineer, it's manager engineer. Then if you get to a certain point, you have a chance to potentially become a partner in the company. So it's a true partnership development, the way that they set it up. And this is incentivizing for people because they like to see progress. It's no different than if you look at like something like martial arts, right? So there's a belt system because it's more engaging for people to see this micro progress they're making. Like, let's say you're whatever, you're in karate, you have a white belt. And let's say you just go to karate class and you're training like crazy for 10 years. And then all of a sudden, 10 years later, they give you a black belt. How many people would stick around for that? Versus, all right, you go to karate, you're a white belt, and then you get some stripes, and then you get a yellow belt, and then, maybe an orange belt or whatever the next belt in the system. But they do that because it's motivating for people to see progress, and they say, oh, wow, look at me. Now I'm proud. I got my new belt, and it's just a sign that you're making progress. You have to think about this with your own company as well, that people need to know what progress they're making. And if you can help them realize that, they will stay motivated along the path much better than no idea what's going on at all. Because if you don't give people an idea of what's next, then they start to view it as a dead end job. This is it. This is all the progress that I've made. This is my life now. And it's going to be my life now for the next 10, 20 years, whatever it is, however long the duration of time is. And that's when people start looking for other things. The grass is always greener somewhere else. And if you don't keep them engaged and motivated to make progress, then they're going to start looking other places. They're going to start looking for other things that they can do where they feel like they're making progress, even though it might be a lateral transfer. It might be the exact same opportunity. They just see it in a different lens. It's something new. It's something that is motivating for them. So you've got to really give people a path forward, a clear path of where they're at, what progress they're making, and to have some sort of highlight as to what that is. It could be a title. It could be pay difference. It could be, any sort of motivating element of them making progress within their business, where you're rewarding them either with something that designates them as being different and or compensates them in a different way. And those are the things that really end up adding a lot of impact to retaining people over a long period of time. So, in summary for this, because I think this is a topic, especially for those of you that have employees, have bigger businesses, it should be very directly tactical and applicable to what you're doing. If you're just getting started, one of the things you can think about that I think is a great exercise is, let's say you're just starting to do your own thing. What could your employer have done from the place where you just left? Like, what could they have done different that would have made you not want to leave? And do that exercise in your head and think about that when you go to then hire and bring other people on, because that's going to really help you reverse engineer what you need to be doing within your own facility to make sure that people are sticking around and you're seeing progress. And they're seeing progress and they're happy and they're enjoying, being part of your company, and they want to be there for a long period of time. So in summary, there's really 5 big things that I went over. I think we said we're going to do 3. I added 2 bonus ones in. There you go. Number 1, culture. Your culture, it's yours. Decide what it is. Make it something awesome. Like, don't start a business just to have a weak ass culture. Make it awesome. 2, pay consistency. Don't make it so erratic for them that they feel like they don't know how much they're going to be able to make the following month, if they're going to be able to pay their mortgage, their student loans. That's the stress that they don't need. Otherwise, if they're under that stress, why wouldn't they go take a bigger swing on themselves? You're driving them towards entrepreneurship. That's the way it works. Number 3, you've got work-life balance. So being flexible with them, letting them have a better mixture of work and life and the things they like to do, and finding meaning not just at work, but outside of work. If you can do that, that's going to help tremendously with stopping burnout. We know burnout is what leads to a lot of people, not just leaving your business, but leaving the profession as well. Number 4 is one-to-one mentorship. So this is you getting one-to-one time with your direct advisor, your direct report, whoever that is. And if you're in a small business, you're going to be the direct report for everybody. So spending one-on-one time with your employees, learning about them, learning about what they're interested in doing, helping them improve both clinically and professionally is going to be huge for you from a retention standpoint, as well as just the happiness of your employees and how long they stick around in your culture. So number 5, it's a clear path forward. What are they looking at doing? What are the next steps? What are the next roles that they can look at doing? What is the timeline on those things? What do they need to do themselves to be able to put them in a place to deserve those roles? Like, they need to know the rules of the game to know if they're winning or losing. This is really big. You've got to be clear with them on this. And this takes some time to really think about what that looks like, because too often we lose great employees, great staff members, because they don't really know what's next. And if it's not communicated to them, eventually they just start to wander to other things, sort of look at other opportunities, other businesses, career paths potentially, because they don't really know if they're making progress. And a lack of momentum is very frustrating for people. It feels like they stifle their growth, and nobody wants that. So make sure that you're clearly letting them know what's going on. You're clearly letting them know what their next steps are. And if you can do that, you should have a great ability to retain the right people. And you're going to have drop off no matter what. People are going to leave your company. Great people are going to leave your company. It's going to happen, and there's nothing you can do about it. You just want to set the stage to where you're not losing people that aren't going to leave anyway. You're keeping people as long as you can, so that they can help you with your mission of helping as many people as possible get back to living a high-performance, pain-free life, like living and enjoying life actively with the people that they love. If you can do that, if you can implement these things, then you're going to see a lot more progress in your business. You're not going to hit these roadblocks where you take, one step forward and then one step back because you just lost your entire workforce. And you're going to be feeling a lot less stressed about your employers or your employees, and then what you're going to be able to do in the next few steps to really grow your business to the next stage for whatever that might be. So hopefully this helps. As always, if you're listening to this on the podcast and you want to watch the video of this, or if you want to ask questions and get involved in the conversation, make sure you head over to the PT Entrepreneurs Facebook group. You can request to join. If you're not a clinician, we're probably not going to let you in. If you are, come on in. You're more than welcome. And one other thing, we greatly appreciate it if you listen to this on iTunes or Spotify. If you like the podcast, and you like what we're saying, and really want to help us get this in front of more people, leave us a rating and review on that. That actually helps us in the algorithm. No one understands how the AI algorithm works, but that right there is definitely something that helps us get in front of more clinicians to share this information with them and really help change their life as well. So if you take a few seconds to do that, I'll greatly appreciate it. As always, thank you so much for listening and watching the Facebook group, and I'll catch you next week.